Thank you, Namaste. As I speak, standing in the forum, I want to sensitize all of you and ensure that this 15 minutes session really makes a difference to you, your family, and the society where you stay. If I do that, then it's justice for me speaking and it's justice for you listening onto the same. I would start by setting the context. If you see India at large, then you see that close to 75% of our people, they are in their villages and they are in rural environment, where they don't even understand all these technological stories, jargons, speeches that we speak out here in a 5-star hotel. For them, the basics is education and healthcare. And any country, any family, any nation grows only on two critical parameters, which is education and number 2 is healthcare. I trust you would agree on the same. Keeping that in mind, we have embarked on a journey to ensure that India stays more healthy. And that is what the topic is all about. What do I mean and how do we do? A large majority of Indian population have immense intensity of being diabetic. I'm sure some of you out here also have the similar problems of consumptions of diabetic medicines and similar and more, where we have a huge population having a series of chronic disease management, including cardiac issues, obs-gynec, diabetic, nephro, peds, so on and so forth. Keeping in mind of how the ecosystem rotates and the Indian healthcare actually operates, anyone in whose house you have a chronic disease patient, be it cardiac, be it diabetic or similar, easily they have to spend close to 5,000 to 7,000 rupees of medicines. With someone whose average salary is close to 30,000 to 35,000 at the most, it is extremely difficult to spend that 5,000 to 7,000 rupees, keeping in mind of the other costs that they have to bear. Why I wanted all of you to understand this is a story that India is unfolding, and we are trying to work very, very closely in every single part of the country, right from Jammu and Kashmir to Kanyakumari, where the costs is what we are pulling down, and pulling down at the run rate of close to around 70%. What do we mean? We mean that the costs of branded medicines, if they consume for 5,000 to 7,000 rupees, and if they do the same Dava India generic medicines, the same quality, similar quality, they get in close to 1,500 to 2,000 rupees. That's a huge game changer for India. Someone whose average salary is 20,000 to 30,000 rupees, a farmer whose average intake by selling the farming items is close to 15,000 to 30,000 rupees or 40,000 rupees, they really cannot afford expensive drugs. And there is where we are building a huge chain of network across the country to ensure the availability of these high quality medicines. And not only in rural, we are also there in urban belts like Bombay, Delhi, Calcutta, so on and so forth, because this is the need of the hour and this is the seriousness of each one of us that need to drive the acumen for India. India would not progress unless we really make India healthy and India educative. In fact, we are also working out to see that if we can change the syllabus of the schools where we bring women's safety into the syllabus, that is where a good corporate comes in action. A good corporate does not come in action, as per my belief system, when they only speak and talk about financial numbers. A good corporate do not come in action when they speak financial numbers and show CSR as a perspective. No. A good corporation actually comes in action when you genuinely think about the land where you operate, and build a better story of the land and for the people of the land. We have more than 1,000 stores across the country that offers very high quality generic medicines to ensure that patients who really cannot afford expensive branded drugs, they can get access to great quality generic medicines. That's the change that India needs. As I personally work in the villages, I see the lament and the cry that the mother have when they really cannot afford medicine when the son is crying. And they break the pills and take, if a physician or a clinician have written a morning, afternoon, evening dosage, they break the pills and take, assuming that, they will save cost. They don't understand that the efficacy in the body may not work as good as if they reduce the dosage. There is where Dava India generic medicine comes into place, where we ensure that you don't need to spend so much money. We are by far present in almost all the therapeutic segments, as what I said: peds, gastro, nephro, obs, gynae, diabetic, cardio, etc. Since it's a storytelling session, I would also narrate some of the incidents that I see very closely and what we have done for that. If you go to the villages, you'll see that in some of the villages, not all, you still have televisions that have come. The mobile network have penetrated. There is a plus on that. I'll show you certain other things. If you are a human in the shield, you will have tears rolling out from your eyes. It is as follows. When someone sees advertisements in mobile telephones or televisions, a young son was asking his mother to buy him one of the drink that he saw in the television. It's a chocolate drink. It's of a prominent brand. And when the mother tries to buy, she sees that she cannot afford that for the son. And the son keeps on crying. Then her mother tells him that she will try to get him in the birthday. Still, she can't afford. Similar incident we found in villages in Rajasthan and West Bengal. When a young mother wanted to buy a malt drink for the family, and they could not afford. And I can go on and on and on. What have we done for that? Now we have launched similar product in all our network by the name of Boren Vedic, by the name of Hor Milk. Only thing is that we have reduced the sugar content and increased the protein content so that it's more healthy and at less than half the cost. There is where the change comes. Change does not come when corporations only try to build revenues. Change does not come when you have flimsy stories to build around and you build a company for 10 or 20 years. I'll give you one more example. Some of you who are vegetarians here, they may get a deficiency of methylcobalamin in the body, prominently known as vitamin B12. If someone gets a deficiency of vitamin B12, usually you have to go to a pharmacy, clinic or hospital to take an injection shot of vitamin B12 to meet the deficiency. It easily costs you something around 300 to 350 rupees. Some of you here feel that, oh, it's only 350 rupees. Trust me, it's not a small money. 350 rupees for most of the Indians is a very, very expensive money. There is where we have came out with vitamin B12 mouth dissolving strips, MD strips, which we call. A thin strip of 1500 mcg costs only 12 rupees. That's the change that India needs. If you don't understand this, then you will come in the conference, you will attend multiple such sessions, and you will go back. But the day you understand this, then each one of you can make a better India in your own field as well. Why I gave these examples? To ignite that what you have lost. Because 75% of our people still stay in the villages. They don't even understand what is marketing. They don't even understand what is AI. They only understand that they have to have food. They only understand that they have to be healthy. But they have aspirations where whenever we go and work in the villages, we find that they want to send their children to big cities, to big places. But for that, they have to survive first. Some of them can't even afford a leather chappal. They wear a rubber chappal. These are the realities. Since it is a discussion on healthcare, and I hail from healthcare, so I'm trying to build and bring to you that it is time that we all really work together to build a better India, whether in the form of our hospitals, whether in the clinics, whether in the pharmacies, and the entire ecosystem, so that India at large can at least become much, much more healthier than what we see. If any questions are there, I'm ready to take the questions. To respect the paucity of time, I have finished within time. Jai Hind.